Today I discuss about how to write the care plan. First I took the antenatal care plan. Here main heading submitted by, then submitted on. Next heading introduction. Introduction as a part of my OPG posting. I was posted in which hospital, you should be write the hospital name, and there I selected one antenatal mother named Mrs. Then old lady who is diagnosed as primigravida. Primigravida means first pregnancy, 30 weeks of gestation. Then baseline data. Next name of the mother, Mary. Then age, sex, marital status, religion, then education, then diagnosis. Here primigravida. Primig means first pregnancy. So gravida 1, pregnancy 0, labor 0, abortion 0, death 0, then stillbirth 0, then with 30 weeks of gestation. Then address, then EDD. EDD means expected delivery date, then last menstrual period. Next heading, socio-economic status. Total number of family members, then number of earning members of the family, monthly income, then housing condition, good, you should be right, water supply, electricity, and their own toilet and good drainage system. Then family history. Here Mrs. Mary belongs to middle class family. There is no hereditary and communicable disease. There is no consanguineous marriage. She belongs to a nuclear family. Consanguineous means same marriage, same relative marriage. Okay. Then name of the members, relation, age, sex, then education, occupation, then marital status, health status, then family geography, husband, wife, wife, here male like this, then female like this. Okay. Then personal history, food habit, mixed, non-veg, veg. Okay. Bowel and bladder pattern, increased frequency of maturation, hobbies watching TV and reading novels, sleep normal, appetite normal, then menstrual history, age of puberty, then flow, moderate flow, then duration 4 to 5 days, then menstrual cycle 30 days, then history of dysmenorrhea, no history. Means old age dysmenorrhea, no history of dysmenorrhea. Marital history, age of marriage 19 years, type of marriage, no, same consanguineous marriage, then relation with the husband, good. Next page. Present medical history, there is no present medical history. Past medical history, there is no past medical history. Present surgical, no, there is no present surgical. Past, no. Okay. Then past obstetrical history. Obstetrical history score is G1, P0, L0, A0, S0, D0. Then there is no past obstetrical history. This is first pregnancy, so no, there is no previous abortion. Then present obstetrical history, first trimester, pregnancy was confirmed by urine test. Which type? She went for regular antenatal checkup. There is no history of excessive bleeding and vomiting. Then second trimester, she told quickening at 20th week. Okay, she was taken tablet for a sulfate and a tablet cell. This is the calcium and iron tablet. Okay, she received the first dose of TT injection at 18 weeks and the second dose of TT injection taken at 24th week of gestation. A third trimester. Now she is running in third trimester. Then physical examination, general assessment. The antenatal mother is moderately and nourished. Head and foot examination. Head, hair is black, no dandruff, like this you should be right. And face, no paler, no patless. Then eyes, normal vision, conjunctive is normal, no eye discharge, preorbital edema is present. Then ears normal, hearing no discharge. Then mouth, tongue is not coated, teeth are equally distributed, no dental caries, no gum bleeding. Neck, no lymph node and thyroid enlargement. Chest is clear. Breast, nipple erect, large and deeply pigmented. Secondary alveolar is present. Abdomen, no scar, linea nigra and stria albinans present. Back, normal curvature of spine. Back pain is present. Then extremities, range of motion possible. Rotation, how to, okay. Pedal edema. The pregnant woman had the edema, so pedal edema is present. Then genitals, no vaginal bleeding, no edema. Then no sign of infection. Antenatal examination. On abdominal examination, inspection, size, approximate to gestational age, counter full, shape oval, then umbilical protruded, skin change, linea nigra present, stria gravida present, then lightening 36 weeks, then abdominal girth 80 cm, fetal movement visible. Then palpation, fundal palpation, soft mass felt in indicated buttocks of the fetus. Okay, soft. The lateral palpation on left side nodules felt, it indicate limbs of fetus. On right side continuous mass felt. Okay, right side the patient having continuous mass felt, is it indicates spine of the fetus. Position is LOA. LO means left occipital anterior. Then pelvic palpation, crib 1, level and round mass indicate head of the fetus. Crib 2, head is not engaged. Then auscultation, fetal heart sound present. Fetal heart rate is 130/6 per minute. Investigation. What are the investigation? Should be right serial number, date, investigation, blood test, RBC, HB, VDRL, albumin, sugar, normal values 70, 120, then 12, 17, then patient range, then remarks. If increase means increased, normal means normal, should be right. Then drugs. So the patient had 2 tablets for a sulfate and a chalcol. Here the dose should be right. Then route, frequency, action, indication, then contraindication, then adverse effect, then nurse's responsibility. What are the nurse? Blood test, for HP and evaluate the improvement of HP. Thought about the iron intake. Check the vital signs. Thought them to add calcium rich food in diet. Give oral calcium. Then nursing diagnosis. Alteration in comfort, back pain related to postural change and hormonal change. Then altered tissue perfusion, edema related to physiological change during pregnancy. Altered nutritional status less than body requirement. Then is related to less intake of nutrition rich food. Then knowledge deficient regarding antenatal care, antenatal exercise and antenatal diet. Here should be assessment, right? You should be right here. Assessment, nurses diagnosis, objectives,